It's two types of flow studies. One is to evaluate the rupture risk of unruptured aneurysms. These flow studies are done with computational fluid dynamics. There is a lot of data evaluating the wall shear stress in unruptured aneurysms, and we are using it particularly to predict the rupture or in patients that present an unruptured aneurysm and you don't know if you need to treat or not. There's a lot of new techniques now, at least particularly in Toronto. We've been doing a partnership with the Engineer University over there. We are doing a high resolution CFD. My partner is a professor called David Steinman. And we've been using very powerful computers, and we've been calculating precisely the turbulence and advanced hemodynamic parameters that in the past it was not available because of computational capabilities of the machines that we had in the past. And the aim now is to collect data prospectively. We are doing a big study in Canada where we will be following unruptured aneurysms. We will look for those parameters, and we will see in the long term, which ones will be related to aneurysm growth or aneurysm rupture.
Because if I understand it, some aneurysms can remain stable for years and
cause
no problem.
Most of them will remain stable. Some will grow and some will rupture before growing or after growing. It's still a big field of research. We are also using vessel wall imaging. We are also using biomarkers. We are using other parameters that we can after associate and create a comprehensive evaluation of a patient once the patient presents with unruptured aneurysm. The other type of flow studies involving aneurysms are the flow studies that we use to control the treatment while we are doing. So today there is a method called optical flow imaging, where during the procedure on the angiographic machine, we can perform a high-speed sequence where we can measure the flow and we can control the treatment as we are performing. This is also it's quite new, it's an advance. In the past, when we were treating an aneurysm, we were looking for contrast stagnation, we were looking for very subjective parameters that we had demonstrated not to be that reliable. And all this evolved now to a more objective evaluation, so we can measure the flow, we can control the influences of anesthesia, vasospasm, and we can see before and after a flow diverting stenting placement. We can see how much the flow changes, and we have thresholds that above and below we can predict the results at 6 months or a year.
And are you approaching the point where you actually have guidelines where you can...
We do, yeah. If you have this tool, this capability, now we are coordinating a study with the Hospital of Bicêtre that will look into prospectively 120 cases, and we will see how good we can be, what will be the value of this tool, what it will add to our treatment. So knowing how much flow we need to change, that we know now, and we will use it during the treatment, and we will see in the long term how good we are compared to the data that we have now available in all centers. Two different methods. One is virtual, it's simulation. The second one is measure. It's a tool developed with Philips, and it's a pretty advanced technology. And at least in our field, we were never that far to have subjective and objective measurements during the procedure. We are up to now on at least the big research centers, we are using big computers, so even as we don't have, we send the image to bigger computational stations. But the idea in the future is once we identify the parameters, we downsize the computational capabilities to have it at least ideally in your phone or on your equipment, so when the patient performs a 3D image, you can also have the hemodynamic parameters in the same equipment.
So ultimately, this can be an incredible preventive measure to capture patients before there's a serious problem.
This is the aim of the research, but up to now we still have a long way to go.